Back with Dr. Fankhauser. Let's talk about gum disease. And obviously, like with everything else, many stages. And we know that gum disease happens to be a silent killer, some people call it. It just doesn't hurt till it's too late. Now, in most dentists, proclaiming gum disease being, of course, the cause and the danger of losing your teeth, and that in itself, it's just not a good thing. Now, in my humble opinion, even as bad as that is, I also have noticed that dentists are goddamn good in putting new teeth in it, implants, crowns, bridges, all that type of stuff. And so eventually that can be fixed again with a fair amount of money, which is stupid to let it go that far. But while this process, a year, 2, 3, maybe 5 or more years of gum disease is going on until the teeth are gone, or some of them are gone, isn't there a huge amount of infection right in the mouth, right at the gateway of the blood vessel, where this infection, that yellow, ugly buzz, that reddish, yellowish, thing, it goes straight into the blood vessels, it goes to the heart, it goes to the brain, it goes to the liver, it goes to the kidney, and it ruins the immune system to a certain degree. An infection is an infection, and nobody would be thinking of having one of those in the finger and not fix it on between the toe and not fix it, or anywhere else in the face and not fix it. So, or am I kind of like way off here that an infection in the gum is very dangerous, never mind losing the teeth, which is bad enough, but actually ruins your overall health? Is there something to it at all?
Well, absolutely. It has been shown that there's a definite connection between infection in the gums and infection that affects heart valves, blood pressure, diabetes, several things.
I think moms who are pregnant, pregnant women seem to be having a lot of underweight babies getting born if they have presence of gum disease. Is that true?
I believe that's right. You see, one of the problems with gum disease is that in the early stages and until it gets towards the end of it, it's not painful. It doesn't cause any pain. So a lot of people do not seek help. One of the first signs is you're going to have bad breath. Okay. So that's one of the things to look into. But if you had gum infection around all of your teeth, it would cover an area the size of your forearm. So
you surely would fix that.
A lesion.
You see that, right?
If you saw that on your arm, you'd say, "Well, I got to do something about that." But in your mouth, you're not aware of it. You don't know what's going on. So. That's something that I know. I've seen a lot of patients in my 35 years that I thought died too young because they had uncontrollable gum disease.
Uncontrollable because it cannot be fixed.
It just got
surgery, or they just didn't fix it.
Well, they didn't fix it until it was too far gone.
I see.
Yeah.
I see.
So too serious.
Too serious.
There are some kinds that are just very hard to get rid of. In the early stages is the best time to treat it. So
because there are those 3 different type of cleaning, if you want to, yes. In terms of gum. It has the normal cleaning, which usually doesn't take an injection. That's what you on an average do every 6 months. Then there's what's called a deep scale cleaning, right? That's where you scrape a little deeper, but not really surgery yet, right?
Yeah. No, not really surgery.
No real surgery. But at that point, the patient already needs an injection usually, right?
Most of the time, yes.
Yeah.
Depends.
And then there's the one where you really cut into the gums and you flap them apart like a chicken, and you really cut. You cannot scrape it out anymore. You have to cut it out, the infection, basically, right?
That is becoming more rare. anyone who would need something like that, we would generally send to a specialist, a periodontist.
Right, but that stage does exist.
Yes. But usually before it gets that serious now, we can take a laser and go around the teeth. It's very comfortable, and we can get rid of a lot of the infection and actually clear it up.
Wow. So they have laser things for that stuff now?
Yes.
Great. But yeah, so would you agree with me, or with, basically many other doctors, that's where I got it from myself, that the infection is much more hideous than the losing the teeth, which in itself, that's a problem, and that's of course a cosmetic problem and all that, and nobody wants that. But like in the meantime,
yes,
that rotten, smelly stuff in your mouth,
yes,
and basically poisoning your body on an hour-by-hour basis, that is much more devastating to the health. I mean, a lowered immune system, which if you have an infection in your body, you have a lowered immune system because all the soldiers need to go and try to fight this infection. So then when the next flu comes, you get it faster.
Yes. Yes.
Who wants that?
And unfortunately, a lot of those people also smoke. And there's a relationship between the smoking and the periodontal or the gum infection also. And if you're doing both of them, you're just really giving yourself a double whammy.
Well, get it cleaned out. Basically, lift that carpet and give your house, your mouth, a good cleaning. Look, babies, if it can get babies underweight born, if you can get the immune system down, there are studies in Japan that the immune system gets so low that a person who has HIV can get easier AIDS. Now, thanks God, most people don't have HIV, but if you can do that, imagine what it just does to the everyday health, the fatigue, all that stuff. Yeah.
Yes.
Let's fix it.
Well, it can be treated much more comfortably now than it used to be. So
that's a good thing. So maybe now people start waking up instead of like having to go, oh my God, I need to cut my gums. Because the whole dental work became much more comfortable. I had a root canal a couple of years ago, and it didn't hurt at all. Yeah, it was a little uncomfortable for about a half an hour, having your mouth open, but it's no big deal.
No.
All right. Well, thanks a lot, Dr. Fankhauser.
Thank you very much.